All right, guys, he's doing it. He is doing it. Donald Trump and his CDC have sent out a letter to states saying, be ready to start distributing a coronavirus vaccine in early November or late October. We can read that as before Election Day. OK, do not mistake this for anything other than what it is. This is exactly what I predicted was going to happen. I told you months ago, the ideal October surprise for Donald Trump is going to be the big heroic announcement of a coronavirus vaccine, even if it's not actually done being tested yet, even if it won't actually be available to almost anybody until 2021. That is going to be Trump's gambit. That is going to be Trump's October surprise to try to win the election. And indeed, as the New York Times is reporting, the CDC has sent a letter outlining to state public health officials how they need to prepare for what Donald Trump is saying is going to be a vaccine in late October or early November. The CDC has notified all 50 states and 5 large cities to be ready to distribute a coronavirus vaccine to healthcare workers right away, subsequently to other people in high-risk groups as soon as late October or early November. Now, over the last week, we've heard from Anthony Fauci and Stephen Hahn from the FDA, who said that it is conceivable that you could make a vaccine available before the phase 3 clinical trials have been completed if the early data is overwhelmingly positive. We have the letter from the FDA. Let's look at it, from Dr. Robert Redfield of the CDC. It reads, dated August 27th, Dear Governors, the U.S. Department of Health and Human Services and CDC are rapidly making preparations to implement large-scale distribution of COVID-19 vaccines in the fall of 2020. This vaccine distribution program is expected to be a public health effort of significant scale, potentially involving hundreds of millions of vaccine doses to be distributed across the U.S. CDC has contracted with McKesson to distribute these vaccines to state and local health departments, medical facilities, doctor offices, and other vaccine providers. In order to accomplish this massive task, McKesson must quickly open new distribution centers and obtain new permits and licenses. These applications may be submitted in McKesson's name or in the name of one of its subsidiaries. Going on to say, in the near future, the appropriate state licensing agency will receive permit applications for the new distribution facilities. Going on to say that states should consider waiving requirements that would prevent these facilities from being fully operational by November 1st. The requirements you may be asked to waive in order to expedite vaccine distribution will not compromise the safety or integrity of the products being distributed. Your assistance in helping expedite the issuance of licenses and permits required for this will be critical to the success of this public health effort to mitigate the threat presented by COVID-19. So why not be more transparent and just say before November 3rd? Because that's really what this is about. Now, I've gotten a lot of emails from viewers saying, do you trust the CDC now with this? I have no idea. Certainly, we knew this was what they were going to go for. People have been asking me, if they approve a coronavirus vaccine with an emergency use order on October 29th, do you go and get in line first for that vaccine? I think that's the wrong question, because I'm not going to be allowed to be first in line. And what I mean by that is there are tens of thousands of people who are receiving the vaccine already in phase 3 trials. The first availability is going to go, as they are saying, to healthcare workers and to at-risk people, older folks, etc. I don't think there's any way I get a vaccine in 2020, regardless of an emergency use authorization. That being said, I understand being very suspicious about the timing of this announcement, because I told you it was going to happen, and now they are planning to do it. Here's why we should be skeptical or worried about distributing a vaccine with emergency use authorization. First of all, it's never been done before with a vaccine, or at least a major vaccine that presumably billions of people are going to want. We've done emergency use authorizations on technicalities. And we've done emergency use authorizations on things like hydroxychloroquine, remdesivir, convalescent plasma. Now, how well did the hydroxychloroquine emergency use authorization go? Not well at all. And in fact, it had to be retracted. So that is because emergency EUAs, as they are called, involve substandard or lesser reviews than for full approval. Are we willing to do that with a vaccine? I don't know the answer to that, but it's definitely something to be thinking about. You know, EUAs for ventilators, EUAs for PPE, maybe for some treatments that appear to be particularly efficacious. Okay, certainly things to talk about. Here, I don't know. And this is a White House that has brutally abused its ability to push the FDA to put out their EUAs. And some of them, like, for example, with hydroxychloroquine, have been revoked because it was a disastrous idea. But I am concerned with the political implications here because Donald Trump is thinking, and it may work. This is the scary thing. The idea would be if Donald Trump can announce a vaccine on October 25th and make the case that he had a role in getting this vaccine out there. And by a role, I mean something other than just bullying the FDA into approving an EUA. Okay. And that's something he can do just with raw power. But what I'm saying is Donald Trump is going to try to sell Americans on the idea that we have an approved vaccine, again, through an EUA earlier than other countries, thanks to Trump. And the reality is any country could skip steps to get a vaccine approved. The UK could be dosing people right now if they had just gone in and said to the about the Oxford vaccine candidate, let's just approve it. And then Oxford vaccine in the UK would say, we got a vaccine early. We saw what happened in Russia with their haphazard early approval of a supposed vaccine. So the gambit is more people will fall for Trump did it than will be skeptical about the politicized nature of this early emergency use authorization. I want a vaccine as badly as anybody, but it's got to be safe. It's got to be done right. We have a process for approving vaccines. Will it work? Will it work to sway even 1% of the vote in key states could give the election to Donald Trump? Let me know what you think. We'll be continuing our coverage of this on the David Pakman Show Instagram page at David Pakman Show. While you're there, I posted a picture this morning of my new prepping elements to my Instagram, david.pakman. I'm ready for a crisis now. I just don't know what kind. Follow me on Instagram at david.pakman. Today, one of our sponsors is Surfshark, which is the VPN that I use to protect my privacy anytime I'm on the internet. They're giving my audience 85% off a 2-year plan. That's under $2 a month. Plus, you'll get 3 extra months for free. It's 2020. It's time for you to start using a VPN if you're not already. Protect yourself against government surveillance, against internet service providers selling your internet history, against tech companies spying on you online. Surfshark is the VPN I trust because unlike other VPNs, they don't monitor or log your activity. It encrypts all your data. You can install it on unlimited devices. It'll block ads. It'll protect you from malware and phishing. There are a ton of other special features that come with it. Go check it out. Surfshark is giving my audience 85% off a 2-year plan, which comes out to less than $2 a month. Plus, you'll get 3 extra months for free. Go to surfshark.deals/Pakman. The link is right underneath this video.